Good morning and welcome to another episode of Coffee and Tea with AARP Connecticut, a biweekly conversation in which AARP staff and volunteers talk to Connecticut decision makers and leaders about policies and programs that are of interest to the age 50 plus and their families in Connecticut. My name is Nora Duncan and I am the state director at AARP Connecticut, and I am pleased to share this week's co-hosting duties with Pat Lang, an AARP Connecticut volunteer from Newington. Today, we are talking about the state of senior centers in Connecticut with Carrie Concatelli. She is the Director of Senior and Social Services in Bolton, and she's president of the Connecticut Association of Senior Center Personnel. I'd like to welcome both of you to Coffee and Tea with AARP. And I think I'll kick things off with asking you both to just introduce yourselves briefly. So Pat, let's start with you.
Thank you. I've been an AARP volunteer for over 8 years now. It doesn't seem that long. And I have visited your senior center a few times, Carrie, because I've done driver safety courses there. So, and it's a lovely senior center. So thank you for inviting us.
Thank you, Pat. Now, Carrie, how about you? Let's briefly introduce yourself.
Thank you, Nora. Thank you so much for having me today. And happy Senior Center Month. September is Senior Center Month. So I am a lifelong Connecticut resident. I'm originally from South Windsor, and I went to Connecticut College in New London and received a master's in social work at UConn School of Social Work, which at the time was in West Hartford. My career has always focused on community-based services for older adults in particular. So I started working with the Connecticut Home Care Program for elders, and then I really wanted to turn to more of a town-wide focus to work on everybody in the community. So now I have the pleasure of both living and working in the beautiful town of Bolton. So in Bolton, you'll find me kayaking on Bolton Lake. You'll find me walking on the rail trails and going to the library with my family. So it's a wonderful place to be, and I'm very happy to be here representing the Connecticut Association of Senior Center Personnel.
Thank you, Carrie. You know what? Tell us about the Connecticut Association of Senior Center Personnel and its role.
So the Connecticut Association of Senior Center Personnel, we also go by CASP. We are a membership organization. We are made up of a variety of senior center professionals in many different roles. We currently have a membership of over 235 participants who represent over 111 senior centers across the state. So what's wonderful about that is it's a fantastic network. We're able to provide trainings, to connect with other professionals, to share ideas, programs, advice, answer questions. So it's really wonderful because, you know, every senior center in Connecticut is extremely unique, but we share a lot of common goals. So it's a great way to work together and learn from each other.
That's great. And I've been pleased to be able to speak to the association in the past and share information. And it's great when we can all collaborate and get the same info and messaging out. Pat, I think you're up.
Okay. Carrie, what are the key services provided by senior centers in Connecticut?
Well, I'm so glad you've taken the opportunity to come visit. You know, when most people think of senior centers, I think probably the first thing that comes to their mind is programs in general, which is true. We offer a variety of programs. We often try to focus on different aspects like fitness and health, recreation, educational programs. But when you say that that's what senior centers do, that's a lot like saying that a library is only about the books. We really do so many more things. And like I said, every single center is unique. We're very different in size and scope, but the commonality is that we serve as a community gathering place, and we're able to help with so many different types of kind of odds and ends. So some places, like you said, have driver safety classes. We might have congregate meals, tax preparation. Some have food pantries. A lot of times we're helping with application assistance for things like energy assistance, housing, questions about home care services. A lot of times there's questions about Medicare, of course, that's definitely a topic that comes up quite a lot. So we're able to provide a lot of information and referral to a variety of community resources that we can tap into. So it may not be something that we offer, but we're able to connect someone to other things around. So really that connection for people is kind of our key. And sometimes that's literally a connection in terms of our really comprehensive transportation programs. Transportation is a big issue, especially a rural town like mine. We are able to get people to appointments, to errands, wherever it is that they want to be. That really has been a key tool, especially the last few years. But most importantly, it's a place to connect with your peers, to explore new interests, take these opportunities. Sometimes there's a program you've never done before, some sort of activity. You can try it out, sample it, meet new people. So it really is a place that people can kind of make it their own, because of course, everyone has different interests. Some people want to come once in a while. Some people want to come on a regular basis. So really, we have something for everybody.
Awesome. It's great to hear about how much you guys do, because I think there's a lot of people who don't really understand. And I know some senior centers do multi-generational activities and programmings, and they're coexisting with their community center, and there's all sorts of great opportunities for the whole family in one place. Carrie, senior centers had a tough time during COVID-19, as we all did, but I think senior centers really had some serious, changes that they had to make and how they had to do their operations. So how have senior centers dealt with it, and what do operations look like now?
Well, COVID was definitely an incredible challenge that we really had to very quickly pivot. We did have, like many places, a period of time where we had what we call a closure to the public, but we never closed. We really, our transportation operations continued. We tried to offer as many programs as we could, but the problem was we had to really change how we did that. So, we had to really kind of rewrite existing operations. Everything that we had done, whether it was an annual program that we knew exactly what to do, we had to rethink. So the problem was, of course, that we saw firsthand how isolation really impacts well-being. This was definitely the social experiment we never wanted, but unfortunately we had to kind of take that result and kind of move with it. So our biggest focus, I think, became outreach, working with people who we identified as the most vulnerable in our communities, how we could keep in touch with them, see what they needed, really identify those needs. One of the ways we did that was we started a lot of frequent publications, which was to focus kind of on entertainment, but it also was to be a critical source of, that rapidly changing information. We started really using technology in new ways. And one way we did that was we created events. We even did drive-through events. Never thought we would do that. We brought services to the individual. And a lot of that really relied on our transportation, the ability to deliver services. And basically, we really tried to eliminate any kind of barriers that might have been in place. If someone was interested in, getting to a vaccine appointment, getting a test, whatever it was, we wanted to remove whatever those barriers may be. Since then, we have fully reopened. This was definitely a slow process that we kind of worked sometimes in collaboration with other centers to discuss, what we were doing for different policies and procedures. A lot of the operations and rules have changed a little bit, but the core is still the same. So we really learned to be flexible and inventive, and really try to meet those needs of the community. So like I said, CAS was really pivotal in that, because we were able to increase communications between each other, discuss to make sure that we were kind of going along the same lines, even though, of course, a lot of us had to go according to what we were doing in our own municipalities, but we also were able to kind of discuss to make sure that there was a little bit of a standard of how to move forward and really kind of help guide each other in those decisions.
Thank you. Are there any other things that people might be surprised to learn about senior centers, Carrie?
Well, we definitely get a lot of, frequently asked questions. I think that many centers are open to more people than just their own town. That's not true in every place. And some senior centers are town run, some are nonprofits. So there is a little bit of a difference, but it's a very collaborative environment. So if one senior center doesn't offer something, we will often help someone find a neighboring center that does. It is not really a competitive field. I think that's something that really surprises people. We're always willing to help each other out. I also think what's really key about senior centers in general is that we offer so many services for a growing segment of our population for sometimes pennies a day. And of course, a lot of senior centers that are municipalities are run as town departments. They are funded by property tax. And that's something that, in this era, people are very concerned about the rising costs of property tax. But the value that you're getting for these types of service is absolutely tremendous, because we really strive to have quality customer service. And most of our programs, we try to keep to no cost or very low cost. We really try to be accessible for everybody. And we're able to answer questions, just with a phone call or stopping in, more things than people realize. So we were able to connect people. Sometimes it's to other things around town. Maybe somebody's looking for the recycling schedule or something like that. We're able to really get them exactly what they need. So we always say to people, just ask. There's something that we can usually do. And if we can't, we can connect with our peers and find out more about other possibilities.
I know transportation in your area has kind of probably always been a problem. What what additional problem did COVID present to you, and how did you solve them?
I think technology sometimes was a little bit of a barrier for people who, needed to have something a little bit more specific for their needs. So a lot of that we worked with, bringing things directly to people, delivering it. Transportation definitely was a key to that. In areas like mine, there's a lot of different doctors' offices now that are in satellite locations, hospitals throughout the state, that we're able to connect people no matter where it is. We don't have to be just tied to, a few streets around us. It really can connect people to anywhere they want to go. And that's something that, when you're living, possibly alone in a single family home, you don't have to feel that isolation. You can feel like you have that independence and freedom to explore.
So much happened with technology during the beginning of the pandemic, and people adopting and accepting technologies they may not have in the past. And, you talk about connecting to hospitals and the like. A lot of the reason that was able to happen via telehealth appointments was because of legislation that passed, enabling legislation so that those services could be paid for. And so I'm wondering, you and your colleagues advocate for yourselves at a municipal and a state level all the time. Is there anything from the 2022 legislative session that passed, or maybe didn't, that you want to highlight? And have you settled on anything for the 2023 legislative session?
So we are extremely proud that pretty recently senior centers were actually added to state statute. That was really an amazing thing to be mentioned and recognized for the work that we do. Formerly, the mention that we really had in state statute was an unfunded mandate that every town in Connecticut offers what we call a municipal agent for the elderly. It's someone who's supposed to be that source of information and referral for people in the community. So this is something that we've all had, but we also wanted to say, but we also offer many other things. So the mention of senior centers was really key. Along with that, we were able to add a position at the State Unit on Aging that is going to focus on being a senior center liaison. So that's going to be really wonderful to be able to all work together like we've been doing statewide, but to really have the ability to move forward, because it's such an exciting time in senior centers. this has given us an opportunity to move forward with new technologies, like you said, new initiatives. We've figured out where barriers are and where we need to keep moving to really offer services to everybody in our community, no matter what level of need they have. So we're really kind of seeing these programs that are kind of coming around the corner and really working together towards that. So we're very excited. Senior centers were included in the state budget this year. So this is an opportunity to put in place a lot of things that we've dreamed about for years. But it's an exciting group of people that we work with. So, it can't get any better than this. I always say I have the most strange job, but I have the best job because it really is cool. You get to meet great people doing all sorts of interesting things and really expanding, what their interests are and trying new things. And that's what I love to see, is seeing people connect with each other.
It's hard to believe that that the state statutes were that outdated that you weren't mentioned until this past legislative session. So that should give you the ability to do some additional advocacy. The person at the State Unit on Aging can help come up with ideas that when there is someone in state government, the opportunity to go to the administration and push for priorities exists in a way that it wouldn't without that person. So good job on getting that done. We have a few minutes left. I want to ask you a question. Well, tell me about it. You just recently received a community challenge grant from AARP, a competitive grant through a national process, one of 3 organizations to win that grant in Connecticut. You want to tell us about what you guys are up to with that?
Sure. We are very proud. Bolton was one of 3 towns in the state of Connecticut who received the AARP Community Challenge Grant. What we are focusing on is really revitalizing an underused outdoor space behind our senior center, which of course we learned through COVID-19 how crucial outdoor spaces are for really having another opportunity to gather. We have a patio with an awning over it, and the town has decided to invest in some new furniture because our current furniture is about 25 years old. So it needs to be revamped, and we are going to be adding with our funding a pickleball court, which is going to be next to some existing bocce courts. So we'll be able to have some benches there for people who want to participate as spectators. We'll have the pickleball game for people who want to be active. And we're going to be using the rest of the area that we have there to add some more outdoor games, a gardening area, which will benefit our food pantry. So the idea is, we kind of said, in sun and shade. We want anyone at any ability level to be able to be out there socializing and having that social engagement in whatever form it is. So if someone wants to sit and play a card game, if someone wants to play a pickleball game, we have so many opportunities for people to get involved. And like we said, that connection with peers is really, the best part of what we have here. People, make these fantastic friendships. So we wanted to have that no matter what ability level someone has. So that space is going to be such a great spot to bring everybody together and really use the space that we've had, but really haven't been able to use to its full potential.
That's great. I look forward to seeing the results. I do actually frequently drive by your senior centers. Maybe I'll swing in. Well,
anytime. You're always welcome.
Carrie Concatelli and Pat Lang, I would love to say thank you for participating in Coffee and Tea with AARP Connecticut and helping us all understand the state of our senior centers in Connecticut. It's great to be with you. And again, celebrate Senior Center Month. Thanks, everybody.